and more brain imaging studies accumulate, the field is gathering a tremendous amount of data. This sets the stage for papers such as Mackey. Mackey combined many of the studies conducted around the world in many thousands of people on the relationship between brain structure and substance use disorders. And they find that there are a broad set of areas really throughout the brain that relate to problems with substance use. Now, the magnitude of these associations are not particularly large in terms of the differences between patients with substance use disorders and healthy individuals. However, the number of brain regions that are implicated is quite diverse. And this suggests that there may be utility in continuing to try to understand how it is that particular measures of brain structure and function relate to problems with substance use disorders. As standardization improves in studies of brain imaging, the movement to use measures for clinical purposes is gradually increasing. One of the most promising measures uses a technique called functional MRI using a network-based connectivity approach. And Yip and colleagues collect functional MRI during a reward task and use information on brain function in networks of regions to predict response in substance use disorders to treatment. The promising findings to emerge here are to suggest that patterns of function in these network-based analyses might one day be useful in predicting which patients with a substance use disorder might be more or less likely to respond to treatment.